The COVID-19 pandemic could stretch on for years if rich countries continue to hoard vaccines. That is the biggest obstacle to recovery, according to immunopathology specialist Professor Sibrane Popema. He urges wealthy nations to donate portions of the vaccines they have purchased to low and middle-income countries that have been priced out of acquiring vaccines.
And the most important thing is for the Western countries not to hoard the vaccines, but make them available to countries, like in Africa. If they don't, and that's really the biggest risk right now, if we don't make vaccines available to all countries, what will happen is that the pandemic will smolder, there will be new variants developing in those countries, and it will come back to haunt us. So really, the countries that have vaccines, and some are sitting on big piles of vaccines, they really have to share them with other countries. It's much more important to have all countries in the world vaccinated for 70% than to have some countries that are vaccinated for 100%. So let's hope that politicians will learn that and that they will not play to their home crowd, because what they really should tell their home crowd is, by doing this, we are putting you at risk for yet another pandemic.
Commenting on vaccine uniformity, Prof. Popema explains that an efficient vaccine developed anywhere in the world will work with the same efficacy elsewhere.
Okay, first of all, all the vaccines that are being used right now have been approved in different countries. In some cases, they have not approved or not even asked for approval in some countries, mostly for political reasons. But what we know, and all the facts are there, that all of these vaccines that have been approved are working. So the Russian vaccine is working fine. The Chinese vaccines are working fine. The American vaccines, basically Pfizer is not an American, it's a German vaccine. Johnson & Johnson vaccine is not an American vaccine, it's a Dutch vaccine. But all of these vaccines work fine. They prevent that people get seriously sick. So that's what they all do, we know that for sure. The second thing is whether they prevent people to get infected totally, we don't know yet for sure. And the third one, whether they really will prevent you to infect somebody else, we also don't know. That will all become clear in the next months, because this is very rapidly developing. But basically what should happen is that countries should recognize the vaccines that have been used in other countries, because all the evidence is that these vaccines are all good vaccines. And when that can happen, and I hope that WHO can play an important role in that, and countries will actually, the United States will be part of WHO again, so I think it can happen. If that happens,